Hello, my name is B.Amos, and today we are going to be introducing a new patient to the Great Falls College Dental Clinic. She identifies as a 21-year-old Caucasian female with a chief complaint of oral pain and a bad taste in her mouth. She also mentions having dry mouth. The patient saw her dentist regularly until this past year and is overdue for her 6-month prophylactic appointment. She says she brushes twice daily with a soft manual toothbrush but does not floss because it is too painful. She would like to leave this appointment with a mouth rinse recommendation that will help her bad breath and that will not burn. The patient's lifestyle raises some concerns. Her diet includes carbonated beverages, chips, and chocolate. These foods are notoriously bad for teeth. She is also a social drinker and smokes half a pack of cigarettes daily. The patient needs to be aware of the dental risks of smoking. Smoking can be contributing to her xerostomia, bad breath, and pain. It could also lead to oral cancer. If the patient took steps to quit smoking, some of her issues might be resolved or decrease their severity. The patient has frequent panic attacks and insomnia. She has also recently overcame a mononucleosis infection. She takes 3 prescription medications, alprazolam, also known as Xanax, estrapicolone, also known as Lunesta, and ethanol estranol with norgastamate, also known as orthotricycline. She also uses over-the-counter lavender oil and cannabidiol oil as supplements. The patient takes half a milligram of immediate-release Xanax oral tablets as needed for her panic attacks. They are a benzodiazepine that enhance the inhibitory effects of GABA, resulting in a less excitable state. They peak 1 to 2 hours after administered and have a half-life of 6.3 to 26.9 hours. The patient takes a 1 milligram oral Lunesta tablet immediately before bedtime. This is a hypnotic drug that treats her insomnia by interacting with GABA receptor complexes. This drug peaks 1 hour after administration and has a half-life of roughly 6 hours. The patient also takes 1 orthotricycline tablet daily as a contraceptive. It is an estrogen and progesterone combination that inhibit ovulation through a negative feedback mechanism on the hypothalamus. It peaks after 1 hour and has a half-life of 18 to 25 hours. The patient also uses 2 over-the-counter supplements. She uses 20 milligrams of lavender oil in a diffuser at night to help with her insomnia. She also takes 50 milligrams of liquid capitanol, commonly referred to as CBD, sublingually in the morning to help with her panic attacks. The therapeutic effects of lavender and CBD are not well known, so we should urge her to talk to her doctor about them. Typically, Xanax and Lunesta are not prescribed concurrently as they can increase side effects such as dizziness, drowsiness, confusion, and difficulty concentrating. The patient has talked to her doctor about these interactions and does not experience these side effects. The lavender could also have a negative narcotic or sedative effect when paired with her Xanax or Lunesta, as they are central nervous system depressants. As far as her lifestyle goes, both Xanax and Lunesta have dangerous side effects when paired with alcohol. The patient should be informed of these effects because she mentioned she was a casual drinker. She is also a smoker and should be informed that smoking while taking orthotricycline can increase the risk of blood clots, stroke, and heart attack. The patient's medications have some dental considerations. Both Lunesta and Xanax can cause xerostomia. The Xanax can also cause dentin hypersensitivity, which may be the cause of her oral pain. Lunesta may be the reason for the bad taste in her mouth, as that is one of its side effects. Also, if the dentist were to prescribe antibiotics, we must be sure to tell the patient that it may affect her contraceptive. After reviewing the patient's medical history, her vitals were taken. She presented with a blood pressure of 108/68 right arm resting. Her pulse was 90 beats per minute, her respirations were 19 respirations per minute, and her temperature was 100.7 degrees Fahrenheit. Her fever is likely due to being at the end stages of her mononucleosis infection. During the patient's intra- and extraoral examination, she demonstrated bilateral, palpable, tender cervical, and submandibular lymph nodes. This is most likely due to her mono-infection. It would be a good idea for her to have a checkup with her doctor. She also had fetid breath and reports her mouth to be unusually dry, most likely caused by her medications. Examination of the patient's tongue shows that she has geographic tongue. This is evident from the map-like patches of missing papillae shown in the picture on the right. This condition does not cause health problems, but may be bringing the patient discomfort. The patient's gingiva has red margins and is swollen on both the maxilla and mandible. She also presents with necrosis of her anterior papilla, especially the mandibular, and she bleeds easily upon light pressure. Her gingival condition may be caused by her oral contraceptive, as they can cause gingival inflammation and bleeding on probing. As stated before, the patient's gingiva bleeds easily upon light pressure, so her bleeding index was 100%. Her probe readings were most likely affected by her gingival inflammation. She has an average probe reading of 3 mm with some 4 mm pockets at the interproximal spaces. Her plaque-free score was 10%, which could mean that she's not brushing effectively. The patient was short on time, so radiographs had to be sent in from her previous dental office. They were only able to locate the anterior films. The radiographs were unremarkable, and new radiographs will have to be taken at her next appointment. Many of her dental concerns may be caused by her prescription medications. She should be advised to talk to her doctor about substitutions or altering dosages to find a long-term solution to her bad breath, painful gingiva, and xerostomia. For now, we could recommend that she has more frequent dental visits. She is at high risk for caries due to her xerostomia. We can also recommend several different types of alcohol-free mouthwash. She also may benefit from a prescription saliva substitute.